Good afternoon, everyone. Conference off by thanking Monica Hendrickson and her team here at the Health Department, who are doing unbelievable work to help us all navigate through the situation we're in. First of all, I'd like to announce that the City of Peoria and Peoria County, along with Woodford and Tazewell counties, will issue a disaster declaration on Wednesday, March the 18th. The declaration is a mechanism to reimburse the cost incurred for the planning, preparation, and fight against COVID-19. It also helps with the costs for recovery and rehabilitation. It allows our organizations to assess how we provide services during this time and make changes if necessary. It's really a mechanism to really flip the switch and help us start the accounting process. Regarding the last point on changing services, as of Wednesday, the March 18th, all City of Peoria and Peoria County buildings will be closed to the public, allowing only staff to enter to do necessary work for the public. Taking this step is one important preventative measure to protect our staff while allowing us to continue our services. Let me reiterate, the staff will be available by email or phone to do their jobs in answer to the public, but the public will not be able to enter the city and county buildings. The city and the county are both looking at electronic options to keep our board and council meetings scheduled, and more information will be coming out from individual agencies with specifics regarding individual departments. The City of Peoria and Peoria County have posted this information on our websites. I want to reassure everyone that we're coordinating with the many area partners to ensure that people are getting what they need, especially our younger people, and that they're getting meals, they're getting the food that they need. I'd like to thank Beth Kreider and her Mass Care and Peoria County efforts to coordinate that food delivery. Information on that can be found on Facebook at Mass Care in Peoria County. And I've said this many times in the last few days, but we're a very giving and compassionate community. If someone wants to donate financial resources, please go to the homepage of the Community Foundation of Central Illinois. A disaster relief fund has been set up there, and their homepage is communityfoundationci.org. The situation continues to change quickly. I would advise everyone to refer to the Peoria City County Health Department website for continually updated information. If you have questions, you can also call 211. I know this is an uncertain time for all of us. Please continue to check on others. Phone calls, check our at-risk population, and please continue to take all preventative measures within your control to protect yourself, our community, and the healthcare workers who are working around the clock to treat our neighbors. We appreciate the public's understanding as we work to navigate the situation and respond quickly in order to protect our staff and the public of whom we serve. Now I'd like to introduce Monica Hendrickson from the Health Department.
Thank you, Mayor Ardis. I would like to actually begin by thanking our community as we work through this response effort. There are changes both weekly, daily, hourly, that require us to rapidly respond. The community's understanding and support has been wonderful for those of us working on the front lines. The current total case count for the Tri-County regions of Peoria, Tazewell, and Woodford County is as follows. 4 total confirmed cases, 2 additional from yesterday, all of whom are self-isolating at home and recovering. 11 total negative tests, 6 additional from yesterday, and there are currently 21 tests pending from our region. When we discuss our testing capability and capacities, it's important to recognize, as was discussed in the governor's address, that when it comes to coronavirus, this is a novel virus, and our testing is specifically related to COVID-19. There are already coronaviruses in the community that are routinely tested upon respiratory panels. Those are not the same as this novel virus, and as such, make sure that when individuals are communicating their status of whether they are a positive case or their concerns around that we're really specifically talking about COVID-19. With that, I'd like to introduce Dr. Stoner, who can also talk about additional respiratory precautions we can take.
Thank you, Monica. I know we've all heard so much about hand washing and social distancing and closing of events and everything else that are being taken as public health measures. But I really wanted to talk today about what we can control, and because there's so many things that we can't control. What we can control are preventing certain diseases. And so there are many people that need to have a pneumonia vaccine, particularly our elderly, people over 50 with a chronic medical disease, or people definitely over 65, even if they're totally healthy, should have a pneumovax vaccine that protects against 23 different kinds of pneumonia. And a flu shot, it's, believe it or not, still not too late to get a flu shot for those people who didn't get one on time. It looks like the flu season is going to extend into late April, and so getting a flu shot now will still protect you. Also, a Tdap vaccine, tetanus, diphtheria, and pertussis, particularly protects you against whooping cough, which if you have whooping cough and COVID-19 would be a really significant disaster for your health. And having one respiratory disease doesn't prevent you from having another. You can have two things at once, and that can really lead to a problem. Then I'd like to focus on some other kind of chronic medical conditions that you really can affect. So people that have underlying persistent asthma and they're on regular daily medicines that they should be on, oftentimes skip their medicines when they start to feel a little bit better, and now is not the time to do that. Take really good care of your asthma. Same with COPD, people with emphysema, chronic bronchitis, take your medicines as prescribed, and if you're really not up to your best, contact your doctor and see if there's things that you can do to even improve your lung function. People that have congestive heart failure, again, if you are not optimized in your care of your congestive heart failure, you need to let your doctor know and see what else can be done to make you better. When we talk about the elderly becoming really vulnerable, it's people that have these coexisting diseases. The last that I'd like to talk about is diabetes, because it's so common. When someone's diabetes is out of control and their blood sugars are high, they truly do not fight off infections as well. The white blood cells just don't work as well, and so people get more and more infections. And so a diabetic who gets COVID-19 is more likely to have a much more severe case. So those are things that we can control. So now is the time to follow the advice of your physicians and work on making certain those diseases are optimized. So thank you.
As Dr. Stoner spoke, there are many things that consider a person at high risk in terms of those comorbidities. And with that, this reiterates the importance of such things such as visitor restrictions, limitations on bars and restaurants, social distancing, minimizing gatherings to decrease transmission opportunities. And with that, the coroner, Jamie Harwood, would like to discuss additional restrictions that are now being placed within funeral homes.
Good afternoon, everyone. With me today is the president of the Illinois Funeral Directors Association, Greg Henderson. My office, as well as other members of the association, met this morning to go through our cognitive plan regarding how to move forward with anyone that potentially passes away from this disease and or people who have services planned for funerals today and moving forward. So with that, I'm going to step aside and let Greg Henderson speak to our release from this morning.
Good afternoon. Our recommendation from the Illinois Funeral Directors Association is based on the CDC recommendations that gatherings should have no more than 10 people, which this unfortunately affects a lot of families. Funeral directors across the area will work with families to try to accommodate their needs. We recommend to have embalming when they want to have a viewing, such as before cremation. And we are recommending to have private graveside services to accommodate that need at this time. And then in the future, when things, there's some normalcy to everything, then we would recommend possibly doing a memorial mass or a memorial service at that time. Any questions on that? Okay, thank you.
Understanding that these are difficult times for adults, it can only be imagined what some of our youth and our children in our community are actually experiencing. So with that, Dr. Bender, President of Unity Place, is here to discuss what we can further do for youth mental health.
Thank you, Monica. Good afternoon. Children and adolescents react in part to crises and disasters such as the one we're facing today based on what they see from the adults around them. When parents and caregivers deal with a disaster calmly and confidently, this is how we can prepare and provide the best support for our children. People become more distressed when they see repeated images or continue to hear about these disasters in the media. Consider limiting the amount of exposure your kids are getting to this disaster if you're one of those type of people that watch the news cycles 24 hours a day. I can relate to this specifically over the course of last weekend when I had the news coverage on and my son started looking distressed. And I asked him what was wrong, and he said, "Daddy, I don't want the virus to get me." I realized in that moment that he was being exposed to this again and again because I was watching it for hours. I turned off the television, I went back to another activity with him, and he started feeling much better. And this kind of really is what cued me into this piece of this. Separation from school, family, and friends can create a great deal of stress and anxiety for children. And this is exactly what we're dealing with right now. The emotional impact of an emergency on a child depend on a child's characteristics and experiences. I'm going to list several of these factors that may impact a child's reaction to these type of disasters now. Direct involvement with the outbreak. So if a family member or a close friend has contracted the virus, this may impact how a child reacts to it. Previous history of trauma is a common trigger or common occurrence for any type of disaster. Well, we often see exacerbation of symptoms in kids and teens who have previous experience or exposure to traumatic events. A belief that a loved one may die, whether that's based on fact or reality or if it's just based on distorted thinking. Loss of a close family member, especially recent. Separation from caregivers can be extremely distressing to kids and teens during crisis. Especially, I'm going to repeat this multiple times, how caregivers respond to the crisis is one of the biggest, most important factors of how kids will respond. As far as different age groups and behaviors we may see in children by different age groups. In the younger children, we may see a return to behaviors that they had previously outgrown. Behaviors such as separation anxiety from a parent or caregiver, bedwetting, bathroom accidents, things like that. Again, in these situations, it's incredibly important to remain calm, don't get angry at the child, deal with it, and move forward. In older children, you may see a greater range of emotions or expressions of angst, including sadness, anger, or fear. Their friends may be spreading false information or exaggerated information, and this is a great opportunity as parents or caregivers to correct that and give accurate information. With preteens and teens, we may start to see more or increased acting out behaviors. This could include recklessness behind the wheel, increased use of drugs and alcohol. Or we may see that they become afraid to leave the home. They may further isolate from family and friends. They may feel overwhelmed. You may see increased infighting with siblings and with parents or caregivers. Most importantly, what can you do to help? Parents and caregivers have some very specific tactics that we can use to help our children, our adolescents, and our youth in a time of crisis. And again, it's by setting a good example for your children by managing your own stress through healthy lifestyle choices, exercising regularly, getting plenty of sleep, and avoiding drugs and alcohol. I can tell you that oftentimes when children are brought in for mental health services, a lot of times what the therapists and the mental health professionals recommend is self-care by the parents or caregivers. They're often surprised by that, but the best caregivers are the ones who take care of themselves. When you are prepared, rested, and relaxed, you can respond better to unexpected events and can make decisions in the best interest of your family and your loved ones. Talk to your children so that they know you are prepared and that you have a plan to keep them safe. Review any safety plans that you may have with them. Having a plan will increase your children's confidence and help give them back a sense of control when they often feel like a lack of control. Stay calm, reassure your children and each other. Talk to them in a way they can understand about what is happening, and provide them with the opportunity to talk about what they are going through and thinking, with the intention of understanding what they're saying, not just waiting to respond. I'm going to leave you all today with a quote from one of my childhood heroes, who said, "Every situation in life is temporary, so when life is good, make sure to enjoy and receive it fully. And when it is not so good, remember that it will not last forever, and better days are on the way." Thank you very much.
Before we move on to questions from the media, just want to remind everyone there are multiple ways for the public to find information around COVID-19. General information can be found by calling the Illinois Department of Public Health COVID hotline number, which is 1-800-889-3931, or visiting the Peoria City County Health Department, Illinois Department of Public Health, and the Centers for Disease Control and Prevention, or CDC, websites. In addition, for those of you looking for services or wanting to link to response efforts within our community, 211 will be providing support for our community's response. You can either call 211 or call 309-999-4029, as well as their website, 211hoi.org. So with that, we'll open up to questions. Please bear with us. We are trying to practice what we preach and make sure we do that social distancing and gathering limitations, so we might be pulling people in from the side as we go through that.
Monica, can you go into more detail about where these two new cases in the Tri-County area are, which counties they're in?
So those two cases are Peoria County. They are currently not listed on the Illinois Department of Public Health website because those are usually released prior to the governor's press conference. These came in right after, but understanding the close proximity to the numbers, they'll be posted tomorrow.
Do we have an update on the first two? Are they doing okay?
They're recovering at home.
The governor announcing the first fatality from this in the state of Illinois. I'm not sure if Dr. Stoner would be best to speak to this, or you. I think a lot of people, kind of the dialogue is, well, it's only the elderly are the ones that are going to, suffer the most from this, but this individual, in their 60s, I would not necessarily consider that old. I guess if you could reiterate to the public the seriousness of, COVID-19 as we just saw evident today.
I think that's a great point in terms of understanding that it's not just an elderly that are affected, it's those with comorbidities that can do a variety of age ranges. The virus can impact anyone, and based on their health will be demonstrated or come forward in different ways. And so that's why it's really important for controlling transmission by taking on the seriousness of those policies, such as social distancing, self-isolating, self-quarantining, and making sure you understand that this is really a way to protect our entire community as a whole.
There was an outbreak in a assisted living facility in a different county in the state. Are we prepared if something were to happen here, similar?
So our long-term care facilities have been linked with our emergency operations center to receive support. In fact, we actually have mass care around aging as one of our key priority areas. And a lot of that information and those restrictions that came by in terms of visitor restrictions completely, understanding that is really geared towards protecting that population.
Monica, do we have an idea of how many total hospital beds we have available in Peoria County and kind of what the capacity is to continue to accept new patients for all this going on?
That's a difficult question because the variety of types of beds, but I can say that your hospital systems here do have what's known as surge capacity. They do prepare for it and have plans in place. We are not at the current point to necessarily require it, but our healthcare system has always planned on how do they respond in those situations. So examples, non-essential surgeries can change your bed counts, or shutting down different procedure points can also do that. So they do have the ability to expand and contract, but there is of course limitations, and that's why again it's really important to make sure those services are for the most critical. Majority of people can stay at home and recover with fever reducing medication, as well as plenty of rest and water, and really take care of themselves at home. We want to save that critical capacity for those that are going to need it.
Well, I want to make sure I got this straight. What you're saying is the people who test positive, for the most part, can stay at home and rest and take like Tylenol or whatever it is. There are no meds for this, so when you say they can take meds, what type of things are you giving them, like Tamiflu or?
So it's not the people that are tested that are able to recover.
Positive.
It's just individuals that have come down with this virus.
Right.
Not everyone will be tested, and some people have mild symptoms versus more severe. Most people, about 80%, will have mild symptoms, and they can stay at home and take medication that treat those symptoms, such as fever reduction, cough control, rest, and fluids. Those are what's really going to help those individuals. Again, 80% will have it and be mild and not necessarily need to see a healthcare provider or be hospitalized for that. And that's why, again, we want to save that critical access care for our most critical patients.
So we've heard that there's a section of OSF in the emergency department that's been reserved for the coronavirus, and that there's currently 4 individuals that tested negative for the flu that are in that area. Do we know, are they part of the pending cases, and is this true that there's a section of OSF already reserved for this?
So all hospital systems, in preparation for COVID-19, put plans in place to make sure that they can properly isolate and protect their staff and other patients. So each hospital system does something differently. I can't really speak to any specifics of any hospital.
Kind of going off of that, can you elaborate? I can't tell you how many messages kind of flood us saying, what about the medical professionals? What about them? Kind of talk about protocols that are either going to be put in place or are already kind of in the works to keep them safe from this.
So our medical professionals have PPE or personal protective equipment on. They do droplet precautions as well as they do active monitoring of their own symptoms. And depending on where they work, such as a long-term care facility, they are asked to monitor the symptoms at home prior to coming to work and then throughout their shifts. So our healthcare providers are making sure that they are protecting themselves and checking on themselves because they understand their importance in their role is in terms of this response efforts.
This question would be for, I don't know if the mayor is still here or if
Patrick
the city
and-
manager can
yes.
speak to it. Since the city buildings will still be open for the staff, what measures are you guys taking in terms of social distancing in the workplace and cleaning?
Well, excuse me, Patrick Urick, Peoria City Manager. One of the things that we are doing is we've enhanced our cleaning of the building. We actually have, with our cleaning crew, we have somebody on days now that's going through the building with a lot of the high touch points of doorknobs and other high visibility, high traffic areas. They're cleaning that on a regular and recurring basis. Initially, right now, we're going to be asking our own employees, are they presenting with any of the symptoms of COVID-19? And if they are, we're going to encourage them to go home. And we've encouraged them all along, if you don't feel well, stay home. And that's the most important thing that you can do right now. With this move, I think by closing the city facilities to the public, we're hoping that we can continue to provide services via phone, via email, making sure that those online services we have are taken care of, and then we'll continue to watch out. The care of our employees is very important to us, and we want to make sure that we're doing it safely as well.
Hey, Patrick, what does this mean for the city council meeting next week? Because obviously that by definition more than 10.
So that's what we're trying to look at right now. One of the things that we're looking at doing with the current approach towards our city council meeting is looking at how many members of the city council can attend telephonically. The governor, in his executive order that he issued 2 days ago or yesterday, it says that he's relaxing the Open Meetings Act requirements to allow for the attendance of public officials, elected officials at meetings via telephone or via electronic means. So we're looking at utilizing the telephone for probably half of the city council. And then we're going to really severely restrict the business of the council to just those time-sensitive items. There may only be 3 items on the agenda, and that's what we'll be looking at.
As far as, you have a lot of workers right now who look at pipes, who look at plumbing, who look at various things. They're having to go into homes in some cases to do some of this. And some of these homes, they're not the cleanest places. Could you, are you going to keep doing those type of inspections? And if so, can you maybe talk about that for like code and for everything else?
So one of the things that we are also looking at is we're looking at business continuity planning and how we'll step down our service delivery as the epidemic and the pandemic grows in its severity here in our region. And that's one of the areas our field workers are very important, that we're looking at their safety as well. But at this point in time, we're going to continue with the services that we have. We may at some point in time say to some of our field staff that they're not going to come into the building. They may work from home. We're going to look at all of our employees to see who can work from home first, and then we're going to adjust accordingly. So we've been working through that process, and we'll continue to map out all the different scenarios as this pandemic progresses. Okay. Thank you.
Without further questions, we will regroup again tomorrow at 4 o'clock, and I believe we are going to be back to that original room, which is 125. Thank you, and have a good day.